All right, future RNs, let's talk. Today, we are diving into one of the heaviest hitting, most important categories on the entire Nclex exam, management of care. We're going to break it all down into a super clear framework you can use, not just to pass, but to start thinking like the amazing nurse you're about to become. Let's dive right in.
So let's kick things off with a really big question. When you finally sit down for that exam, what's the single most important skill they're actually testing you on? And I'll give you a hint, it has nothing to do with memorizing every single page of your textbook. The answer? It's your clinical judgment. It's all about your ability to make safe, smart decisions when the pressure is on. And you know where they test this the most? Right here in the management of care section. This is the skill that separates the novices from the pros, and trust me, the Nclex knows it.
So, to really nail this, we're going to organize our thinking around 3 core competencies. Think of these as the pillars of your nursing practice.
First up, competency number 1, your moral and legal compass. These are the fundamental, non-negotiable rules of the road that are going to guide every single thing you do.
So, this right here, this is your ethical roadmap. You've got principles like beneficence, which is really just a fancy way of saying your job is to do good. And then you have autonomy, which is all about respecting a patient's right to make their own choices, even if you don't agree with them. These aren't just buzzwords, they're the why behind your actions.
And speaking of non-negotiables, let's talk about confidentiality. Under HIPAA, protecting patient information isn't just a good idea, it's the law. It's absolute. This means you never, ever share details without permission. You are the firewall, the gatekeeper of their most private information.
Now we get to the legal side of things, torts. I know, it sounds like a scary law school word, but a tort is simply a wrongful act that causes harm. And you can bet the Nclex loves to see if you know the difference between an unintentional mistake and a willful violation of a patient's rights.
Let's get really clear on this, because it's a big one. Negligence is failing to take a basic precaution, like you know your patient is a fall risk, but you forget to put the bed rails up. Malpractice is more specific. That's a professional failure, something a reasonably prudent nurse wouldn't have done that directly causes harm, like a major medication error. Knowing that difference is absolutely crucial.
Okay, on to our second competency, leading the healthcare team. See, you're not just a caregiver, you're a leader, and that means you have to get really good at delegation and supervision.
Before you ask anyone to do anything, you have to run it through this mental checklist, the 5 rights of delegation. Is this the right task, for the right person, in the right situation? Did I give clear instructions? And am I supervising properly? And remember this is key. Even when you delegate the task, you always keep the accountability.
So let's break down who can do what. As the RN, you take the unstable patients, you do the initial assessments, and you handle the primary teaching. LPNs, they can care for stable clients and reinforce the teaching you've already started. And UIPs are absolute lifesavers when it comes to ADLs and taking vitals, but only on stable clients. The golden rule? You never ever delegate assessment, teaching, or evaluation. Period.
And our third competency is what I call the juggling act. This is all about managing multiple patients, shifting priorities on the fly. It's where your clinical judgment is really, truly put to the ultimate test. Just picture it for a second. You have 4 call lights going off, a doctor's on the phone holding for you, and a family member is trying to ask you a question. It feels like chaos, right? So how in the world do you decide who gets your attention first? The answer is always the ABCs. Airway, breathing, circulation. A patient who is choking, that's an airway problem. They take priority over everyone else. Someone in respiratory distress, that's breathing. A patient with an active hemorrhage, circulation. You have to see the immediate life threats first, no exceptions. So after the ABCs, your very next filter is client stability. An unstable client is always a higher priority than a stable one. Here's a huge Nclex tip. Look at the timeline. A patient who is less than 12 hours post-op from general anesthesia, they're considered unstable. A brand new admission to your floor, unstable. Why? Because their outcomes are still unpredictable. Okay, so quick pop quiz. A client is 10 hours post-op from general anesthesia, stable or unstable? You got it. Unstable. They automatically move up your priority list. Once you've prioritized, you gotta communicate clearly. And SBR is the gold standard for talking to other providers. It's a clean, simple framework to make sure nothing important gets lost in translation. Here's the situation, here's the background, here's my assessment, and here's my recommendation. Done.
And finally, let's talk charting. You know the old saying, if it wasn't documented, it wasn't done. The rules are simple, but they are so critical. Do chart accurately and objectively. Don't put it off. And never, ever, ever chart for someone else. Your documentation is a legal record. Treat it like one.
Phew. All right, let's bring it all together. We've covered a lot of ground, so let's boil it all down to the things that matter most. It all comes down to mastering these 3 things. Number 1, your compass. That means you always act with ethical and legal integrity. Number 2, your leadership. You delegate safely, you delegate effectively. And number 3, your juggle. You know how to prioritize and communicate clearly when everything is happening all at once. This isn't just a list of topics. This is the skill set of a confident, competent RN.
So you have the framework now. You have the roadmap for success. The question isn't if you can do this. The question is, how will you use this knowledge, this framework, to build your confidence and walk into that testing center ready to conquer the Nclex?